Welcome to Soul Care with your host, Vasi, where healing meets the heart. This show dives into all things wellness, from holistic and spiritual healing to expert insights on health and self-care. Get ready for meaningful conversations, special guests, and inspiration for your journey to well-being. If you have any questions about home health care or want to continue the conversation, contact Lori today at 561-821-5811 or visit sunshinehomecareservices.com. Let's begin.
Hello, everybody. This is Lori, the owner of Sunshine Home Care Services, and I'm here today returning to you with this week's episode. And we are again highlighting voices and in healthcare, wellness, and compassionate living. I am very honored today for my guest, Dr. Avianne. And I had a pause when I pronounced her name because many conversations led me to how doctors want to be called. And I would love to hear how doctor would like me to call her. But she's a concierge doctor, founder of ACE Longevity, concierge medical practice dedicated to helping patients live healthier life. And aren't we all focused on that? Aren't we all so focused today in learning and engaging in more beautiful conversations? Dr. Avi brings a decade of clinical experiences, blending traditional medicine with cutting-edge approaches and preventing and longevity care. And she also volunteers, which I like the most, her time to Caridad Center, Florida, which is the largest free healthcare clinic, showing true passion for her community, service, and access to care. But today we are excited to have her join us and share her ability and insights in proactive health, as well in personalized medicine, and what it truly means so much to Sunshine Home Care Services. We are very honored, and in the same time we are very inspired, and we are looking forward to be having beautiful conversations today. I wish you all could see the beautiful soul we have here with us, because not only that she shines within, but she is a very inspiring person. So we are looking forward to have this get going. So we have a couple of questions, but we would love to hear your intro, and we would love to know more about you and what inspired you on this journey. I know we had a couple of conversations before the show, and I was inspired right away. It just blended in like we knew each other forever. And I would love to hear more of what motivated you to launch ACE Longevity.
Wow. Well, first of all, what an introduction. And it truly is my honor and privilege to be with you. And you have such a warm, bright energy. So although this could be a little bit nerve-wracking, like you've put me at ease. So I can't wait to have our discussion and hopefully share some powerful insights. So in terms of what led me to launch ACE Longevity, so I've been in medicine practicing for over a decade. I worked in value-based care, which basically means that we take care of seniors with a lot of chronic medical diseases and conditions. So, I felt that there was a need for us to move more upstream and focus on prevention. So before the disease actually forms, like what can we do for patients to help identify risk factors for certain diseases and then implement strategies so that we can avoid chronic diseases and conditions. So I also noticed that within the traditional system that time really was limited, and for true healing to begin, the physician and the patient, we really need time together. So within this model, we focus on relationships, we invest time with our patients, we use a data-driven approach to get our patients the insights needed so that we can make changes to improve overall health and well-being.
This is so amazing, and we are talking about preventive and longevity-focused care, which as well brings Sunshine Home Care Services in such a bright spot, because that's what we are trying to keep every soul, and I like to call them souls. I don't call them humans. I don't call them seniors. I call them souls.
I love that.
And that's how our show is called Soul Care.
Love that.
Because before everything, we got to take care of their beautiful soul.
That is beautiful.
You become so, so trapped into your body that after a certain age you kind of, neglect that actually your soul is needs to be looked after. And then
love
everything
that.
else comes with it.
I love that, and it brings up a really important point about the mind and the body and the soul. They're so connected and they're treated as separate entities, but the reality is that they're one and the same. So I love that you brought that point up.
Shen, Qi, Jin.
Look at that.
And from your perspective, why is prevention such a powerful tool today in healthcare landscape? And we spoke about as well our skin and our changes.
Yes. Okay, so that's a great question. And in general, we could think of prevention being more cost effective than cure. But that's such a superficial answer. And I think that when we, peel the layers back, like prevention actually saves us time, right? So it's us basically investing in our future and protecting our most valuable assets, such as time, so that we can use our time to do what we love the most for as long as possible. So for example, if we are not focusing on prevention and we're not taking a proactive approach, then we can bet, and we can, I think with a lot of certainty, we can ensure that we may need to spend time down the line, whether it's in a hospital or not being well, and then we're not, that detracts us from what fills our cup and what fills our soul. So I think that when we're focusing on prevention, it truly allows us to focus on what matters most and allows us to show up in life the best way that we would want to. And the skin conversation, I know it's a totally, different direction, but I do think it is of interest, and I think it highlights this type of medicine where we go beneath the hood. So, for example, I know for a lot of women, as we enter into perimenopause and menopause, we start noticing all kinds of changes, so skin changes, etc. And we often don't make the connection with what's going on inside of our bodies. So estradiol, for example, it fluctuates, so it goes up and down. And estradiol, there's so many benefits and so many effects when it is on the down. So I think that's one area where we can, a small example of an area where we can get ahead of the eighth ball, know what's going on inside of our bodies, and address the root cause of disease and not just be reactive to what's happening.
That you just opened another can of interesting conversations, and I can open up and we can talk about it really in another show.
Okay,
about this
course.
conversation where it comes to skin and when it comes to the first signs of something going wrong in your body, and how do we trigger, how do we prevent, and how do we actually use our resources, and where do we go. And concierge medicine offers patients more personalized healthcare experiences. What are some of the unique benefits that your model provides, and particularly what terms and patient outcomes and relationships?
Oh my God, so you hit the nail on the head. So first, it's really prioritizing the relationship. And when you think about the traditional model, the average physician, you care for about 3,000 patients. So that's a high volume. I also want to bring up the fact that, physician incentives sometimes are not always aligned to the patient benefit. So the incentives usually are for volume and efficiency. So, 10-minute visits, maybe 15 minutes if it's an annual physical. And that keeps you kind of on this conveyor belt, not really conducive for relationships or diving deeper into your health. So I would say one of the biggest benefits of, this type of personalized medication, one is medicine is actually direct, easy access to your care team. So ease of access, such as texting and email, really that personal relationships. You're not just a number, but you are a soul that we care very deeply about, your overall well-being. But then also the ability to zoom out and leverage newer advanced tools and technologies that may not necessarily be offered through the insurance company, but although that may be the case, now the decision is not up to the insurance company, the decision is up to the beautiful soul. So we help our patients kind of understand, hey, what are my options? What are the tools available? What is covered by my insurance? What is not covered by my insurance? What is the cost of that? Because transparency in pricing is very important. And then now that we have all of this information and this data, then what are we going to do for your unique individual journey, which is going to look so different from somebody else's? So I would say that is one of the biggest benefits, is just really this holistic approach, and also the transparency and the autonomy for the patient with decision making.
Well, that's so wonderful. What the most part of your answer, I'm thinking of when I do a care plan in my personalized care. It's always the biggest issue is the financial part.
Yes.
Am I covered? What am I doing? Long-term insurance? What do I have? And this is where the anxiety of the expenses that come with it, it should not be a problem. It should be a discussion. You always have to think of prevention, health, and how personalized care, personalized medication, medicine, it's always going to benefit you in long term, and it's always going to help prevent and establish that relationship with your soul that is actually needed.
Yes.
And how can we, can you walk us through a typical personalized care plan? I am so intrigued, and I'm so looking forward to hear your answer.
Yeah.
And how does it look at ACE longevity, and how do you approach tailoring health strategies to each individual?
Amazing
I know that's the hardest
question.
part of my job.
It's a great question. So, this all starts with gathering information. So one, the process, like I'm sure yours may be, unfortunately, it's the forms, but the good news is for us it's efficient. We would send the forms, the intake forms electronically. Usually we would have a conversation to identify that we're a great fit. And then we would set up time for a comprehensive initial visit. And, the average visit time for a new patient might be 15 to 20 minutes. We spend usually 75 minutes, sometimes up to 90 minutes, just learning about your history and your story and diving deep into, the past medical issues and, the surgeries and the allergies, but also your health goals and like what are you trying to accomplish. Usually then we would order comprehensive panel blood work, and it's quite extensive. So we try to give our patients a heads up that hey, there'd be quite a lot of vials drawn, so make sure you're hydrated and you're going into this knowing what to expect. We're very detailed. So for example, if this is a, let's say, perimenopausal woman, we want to get very specific with which day of her cycle we would want to, let's say, check her progesterone. So we would give clear instruction, like, I would like you to check it on this day of your cycle, at this time in the morning, because we may want to look at your cortisol levels. And the comprehensive blood work usually would include advanced biomarkers, which are very important, which traditional medicine often neglects. So the Lp(a) and the ApoB are actually more specific markers for cardiovascular disease than a standard lipid panel. Also, it gives us deeper insight into who is an ideal candidate, let's say, for a statin, because that's another conversation. In some cases they are overprescribed, and in some cases patients who may need it are not offered it. So there's a lot there. But we would do the full comprehensive blood work. We will then set up a time to meet again, another, let's say, 60 to 75 minutes, where we're very detailed. These are your white cells, these are your red cells, this is your kidney function, this is the liver function, this is what your hormones are doing. And we paint the picture of what's going on under the hood, I like to say. And then based on that, we come up with a care plan. So usually the plan will, start with, let's get up to date with all your standard screenings. Let's just make sure that's done. And then we would, whether it's tailored supplement support, specific maybe medications, we often try not to prioritize medications, but we kind of detail that out, whether it's lifestyle changes, or nutrition, exercise, optimizing sleep, managing stress. All of these things have like such an impact on your overall health, and those actually go into the individual care plan as well.
This is almost like a dream come true, because when you think about our challenges growing up, my challenges were always finding out and finding the right solution and having access to information, and as well to the doctors.
Yes.
We not necessarily like the care plan you're talking about and everything else. It's we missed out in our life, the upbringing, the preparation for what we are and who we are today. So this is where you come in with your services today that weren't a thing 20 years ago.
Right.
I wish I had that upbringing, you know, where you have a concierge doctor, where you reach out, you do all the right things, you invest the right money in the right tools, and then you age beautifully.
Yeah.
So we're going to go for a commercial break. We'll be right back.
Awesome.
Receive the very best in home care. At Sunshine Home Care Services, our mission is simple yet profound: to support and enhance the lives of our clients. We genuinely enhance the quality of life and offer a comprehensive suite of 26 services tailored to meet every need. We go beyond the basics with health monitoring, emotional support, pet care, and home safety checks. Sunshine Home Care Services is more than just a service. It's a partnership in care. We invite you to experience the difference a compassionate team can make. For a personal consultation, call us today at 561-821-5811.
Do you want the opportunity to have a TV show or podcast? Now, at Amp Media Productions, you can host your very own visual broadcast anywhere around the world. With our talented group of creators, we will provide you with show elements, board operations, and any on-screen visuals you'd like to showcase. All you must do is log onto your computer and communicate with your viewers. Contact Amp Media Productions at 866-224-5422 or email hello@amp2.tv to start your own show today.
Welcome back to Soul Care with Lori Vasi, where we explore the power of healing, mind, body, and soul. If you have any questions about home health care or want to continue the conversation, contact Lori today at 561-821-5811 or visit sunshinehomecareservices.com. Now, let's get back to the show.
Welcome back. Thank you again for joining us today, Dr. Avi. And I know you gave me the permission to call you Dr. Avi.
Yes.
And we are so honored to talk about your practice and our beautiful Sunshine Home Care Services that we are so honored and proud to be leading. And today, our next question will be talking and receiving in-home care. How comfortable are the home settings impacting patient physical and emotional well-being? And this is one of, I wouldn't say of the discussion I always have with the family, that the cases I'm taking over, and the clients and patients. I'm calling them always my soul family. And I would love to hear, what is your input of?
Wow. I feel like the work that you and your team are doing is so mission critical for the overall well-being, not just of the soul that's under your care, but also for the well-being of the family. I think that there's a lot of data, by the way, and evidence to show that the worst place to check, someone's blood pressure, for example, is in a doctor's office. So, the fact that you are in the home, being compassionate in a comfortable environment where we can actually have data that's accurately reflecting the status of the patient, especially with elderly patients, you remove them from, the safe space. And what we can see happen as well, things like delirium, memory issues, kind of. So the more we can protect the soul and keep them in an environment that is comfortable and familiar to them, the better, I would say, the more accurate information that we have, and better able to manage and care for the patient.
I love your answer. And in-home care doesn't have to be at a certain age. And this is what I'm trying to educate people around me, that people have challenges at such an early age. There are tools to identify and trigger and prevent how the future is going to look like. And having I started looking into all my history and everything I do, all my habits, and try to prevent that, what's going to happen in 30 years from now, which I'm, doing right now. So trying to look into better habits and have a concierge doctor like Dr. Avi, it is so critical for prevention. It's unbelievable. And if you're there, or you need help, or you need support, or you have questions, we are always here to answer. But at Sunshine Home Care Services, we always focus on providing compassion in home care. How do you see the home care complementing your work in concierge and also preventive medicine?
It definitely bridges a big gap. And I think what we find in medicine is that, oftentimes you're in the visit with, let's say, this wonderful soul that's under your care. And there's a miscommunication and a lot of confusion. So sometimes there are multiple medication bottles, duplicates of the same thing, or running out of a medication that was never refilled that's like really well needed. So, this home care service really is an extension of life-saving care, really, that can change the course and change the trajectory of somebody's life. So I see this as, super complementary and almost like super necessary to really provide the holistic care that that person deserves.
It is the biggest challenge I have is, I'm not a doctor. I cannot medically advise anyone, but the biggest chaos in every senior life is the medication mixes.
Yes.
It's a recipe for disaster.
Yes.
I feel drowsy, I feel anxious,
Yes.
I feel clumsy, I feel the way I feel, and there's always an answer, and most of the time is medication,
Yes.
like mixes, and
Yes.
the overdose and
Yes.
underdose and mix,
Yep.
and that it needs to be looked into right away.
100%.
And they often is hard to admit that is the wrong thing, because I wouldn't say addiction, but I would say
Right.
makes you feel better for in the moment.
Right.
But it's always a doctor advice is necessary, and it's
and the collaboration, I think, is very important.
very important.
Yeah.
Absolutely. Where do you see the future of healthcare heading, and especially that relates to aging, which we
Yes.
spoke about, and also the personalized medicine, but how can be delivered beyond traditional clinics and hospitals?
I love that, and it ties into the last question about the biggest sometimes concerns would be the medications, and there is this phenomenon of overprescribing and a lot of confusion with the meds. Are you on this? Are you on that? Let me change the dose, etc. So the future of medicine really is a world where medications really are not prioritized, but it's lifestyle that is prioritized. So, thinking about food as medicine, movement as medicine, and the lifestyle factors, which would be, optimizing sleep and stress management, that sense of community, super important for our health and well-being, and also avoiding, certain toxic substances and the exposures that we have. So the future of medicine really is deprioritizing the role of medications to treat disease, focusing on reversing disease with lifestyle, and also leveraging facilities such as gyms, physical therapy, to actually deliver high impact care. So I really feel like the future is bright for us when we think about this.
What a beautiful answer. I wanna touch base. Two more questions. We have 5 more minutes to go, but I have so many questions that I want to ask. But what I wanted to ask you is about the Caridad volunteer.
Yes.
I love volunteering, and I believe my best experiences and my best lessons in life were through volunteering, and volunteering in unexpected places, and humbled me so much that I did homeless shelters, I did a lots of places, and you doing the Caridad, which is the free home health home care service, it's so inspiring, and I want to hear about it as long as you can take your...
Yeah, so Caridad is a very special place, not just in my heart, but throughout Florida. It is the largest free clinic serving the underserved. So, patients from all different walks of life. I feel very fortunate that I have the opportunity to volunteer every Thursday morning at Caridad. I've learned so much. The patients are extremely kind. They're so grateful, but I'm also inspired by my colleagues who are other physicians in the community who have dedicated their time to, invest and care for patients who actually need it the most. So this is something that I look forward to. It fills my cup. It brightens my day. And the very interesting thing that I've noticed is that, the quality of care, that our patients, have access to in private practice, is very similar to what we can provide, at Caridad. Some of the novel tools and technologies, may not be as available because of cost, etc. However, the quality of care, the relationship with the physician, the time that we are allowed to spend with the patient, I think it really is on par with what is delivered in our private practice.
Lastly, what a vibrant life means to you, and what are the actions and the step to have and to take in order to have at least a piece of your beautiful, vibrant life?
I love that. So a vibrant life to me means living not just long, but having a high quality of life for as long as possible. That will allow me and, my family to enjoy the things that we love, whether it's hiking, it might be skiing, traveling, to travel, for example, when I'm 80, I'm going to need a lot of muscle mass. So I have to work on my muscles now. So in terms of, actionable things that we can do, I would say prioritize investing in your muscle mass because you're going to need that as you age. The same things that we've spoken about. So prioritizing whole foods, eliminating processed foods, managing, stress, maybe developing a mindfulness-based practice, and prioritizing sleep because, there's science behind this. It's not just like woo-woo stuff. There's data and evidence to support that optimizing these pillars of lifestyle really lead to high quality of life.
Dr. Avi, I cannot thank you enough for joining me today. It was absolutely amazing, inspiring, and you are vibrating. You are a beautiful person. But I want to thank you very much for tuning in today for Soul Care with Sunshine Home Care Services. We are a non-medical in-home care. So if you have any questions, if you need my help, my advice, you call us at 561-821-5811, and I'll be the one answering all your questions. Thank you for tuning in. Dr. Avi, thank you so much for being here with us.
Thank you.
Thank you for watching this episode of Soul Care. We hope today's conversation inspired you on your path to healing and wellness. Remember, true well-being starts from within. If you have any questions about home health care or want to continue the conversation, contact Lori today at 561-821-5811 or visit sunshinehomecareservices.com. Until next time, take care of yourself, take care of others, and take care of your soul.